Okay. Hi everyone. My name is Kiwumulo Jane Melisa, and I'm a warrior, sickle cell warrior. The main issue today are to talk about sickle cell and also the life of a sickler. In simple terms, if I'm to give details about sickle cell is a disease. I think you find that the community doesn't know much about it, but some of the symptoms bring joint pains. Um, we always have low blood in our bodies, and also you find us having issues with oxygen levels that are always low at a point. So if you have a child with such symptoms, please try to go and check for sickle cells. I want to bring more light about sickle cell so that people know about it. Most people are not so aware of it. They don't know anything. When you go through details into numbers, you find that few people know about sickle cells, and most of them think it's either witchcraft or some disability, but it's a disease. It's like the way you see malaria, asthma, but just that the symptoms are different. And by another thing, it doesn't heal. At the moment, we don't know any medicine that can heal, but we have measurements that are being taken or medicines that they use to reduce, especially the pain. Because the most challenging part is the pain, the joint pain. When I say the joint pain, I'm not meaning one joint. I'm meaning every joint of your body. If anywhere you say joint on your body, what in Uganda what we call a nyingo, yeah, every joint on your body. So this is it's always hard. It's a challenging moment when you get this pain. That's why you find us taking a lot of painkillers, for example Panadol, paracetamol. People, yeah, we take ibuprofen, we take gofen, and it depends actually. Today if you see me taking Panadol and the next day you see me taking ibuprofen, next it depends actually sometimes on the level of the pain, and also um, the painkiller that at that moment that is available. So I argue that the community gets to know about this. I want especially the men, please don't run away when you get such babies in your homes. Please, I urge you that you go and get these tests. You check for sickle cell. Don't check only for HIV. It's a good thing that you do that, but also sickle cells, please. Make sure that you know your status, because you may find, for example, me, I'm a carrier, I'm a sickler, sorry, and you may find someone is a carrier, another person is a normal person. So those are the three people. In sickle cell, we have three types of people. Let me call them types. We have the normal, the carriers, and the sicklers. The normal people are the ones that don't have any genes of sickle cell, and then the carriers, they have the genes but they're not affected by this disease. It doesn't affect them at any point, like these symptoms don't come, they don't affect them. And then the carriers, these symptoms affect us, they come, should I say, they show themselves out, you experience them. Yeah, so you may find that your carrier and your partner is carrier and you don't know. That's why you get such babies. For my case, it's the same thing. Both my parents were carriers, but I didn't know. So that's in most cases, most times you find that they both don't know. And at some point when this child is given birth, most men, they run away. I thank the few that are already staying, the fathers that are staying with us to help us out, to fight with us, because it's really challenging for the caretakers. If I don't know if you ever interact with one, they'll tell you how challenging it is, because it's really massive pain. Mm, Another thing I can talk about sickle cell. Please, it's not an airborne disease. Some people, when we told them that we have sickle cells, they always run away. They tell us, don't come near me, Bambi, please. But I just want to tell you, it's not an airborne disease. Please, we don't blame you for sending us away, but again, at one point, please, we're also people, like we are humans. Please try to understand us. And when we say to the doctors, when we say we have sickle cells, when we say we're having pain, don't take it as if it's a joke, because I know most of you take have not been taking this serious, but it's really a serious thing. uh, Communities that are out, please try to educate others. And if you're sick like yourself, please don't fear to talk about yourself. Don't feel bad about yourself. It's not you that brought that to yourself, I tell you this. And it's not a crime that you have it. If people let you down, it's fine. Keep going. Fight for your life, please. Fight for it, yeah. If it means taking the painkillers, do. And leave along the painkiller, also take folic acid. It helps out. Also, we take hydroxyurea. It's a new tab. I know at the moment it's not that so convenient for all of us. Most people are not taking it, but if it treats you well in the first stages, please continue taking it. It helps out to reduce on the number of crisis that you get. For us, what you call an attack, for us we call it a crisis in sickle cell. Yeah. So please, if a sickler says I'm having a crisis, it means she's having an attack. So I just want to tell you those brief, meanings. When I say I'm having a crisis, it means I'm having an attack. I'm having a pain, I'm having an attack. It's the same thing. Another thing, sickle cell has brought also pain. Let me call it AVN. My friend, they talked about it, but just a simple thing about it, she left it out. To me, my urge is coming to the community. Me myself, I've experienced AVN, that pain, hip joint. You get, your head, the ball of your bone starts cracking. I don't know how to explain that, but that is it. So you find yourself having a really bad movement. The way you move, the way you sit, and you find the community judging, especially the girls. They will start saying a lot to be said. If you are experiencing that, please, it's okay. You'll go through it. So the community out there, if you see a sickler walking in such a way, please don't judge. Don't judge. Just feel sorry for them, but don't judge. Don't say what you don't know. I know people always think, actually Africans, we think we know, but what you don't know, don't just let it be. So please help them out and tell them it's okay. They can be operated. AVN can be operated. They can have transplants. They can put, it's a long procedure, but it's expensive. But I urge you that, apart from helping us with hydroxyurea, I request the organization that can help, and also the government, please, if they can put some money aside for also that, it will be really something good, and we shall appreciate that, because a lot of sicklers are out there, and they need to get these operations. I request that they help them out. It's a lot, but at the meantime, I think that is enough. Yeah, have a great time and all that.